So we will next examine for the tibial nerve. The tibial nerve is one of the major nerves of the lower extremity, and it supplies primarily muscles that flex the foot and the toes. So in other words, a so-called plantar flexion. It also supplies inversion function via the posterior tibialis muscle, and it supplies all the foot intrinsic muscles. So we'll sequentially demonstrate some of the key examination features for the tibial nerve. So first of all, I'm going to demonstrate inversion. So I'm going to ask the gentleman to turn his ankle inward, and I'm going to try to resist him so you can see he's inverting. Just bring the leg to neutral. So that's neutral. Bring it back in again. That's inversion, and bring it out. That's eversion. So inversion is the posterior tibialis function. Next, I'm going to just ask him to just relax his leg. I want to push down against the stand, and what we're seeing there is strong gastrosoleus muscle contraction here in the back of the calf, which allows him to plantar flex his ankle. We can also ask him to relax his hand, and I'm going to now have him push my hand away. Please push me away. I'm trying to overcome him, and I cannot overcome the strong gastrosoleus muscle contraction. Next, I'm going to test the long flexures of the fingers, and the best way to do that is simply to put your fingers behind his toes and ask him to grab your fingers in with his toes. And you can see he's strongly flexing his large and small toes downward with that maneuver. Just relax. Do it again. You can see that flexion of the toes. And finally, the intrinsic muscles of the foot, which are innervated by the tibial nerve, are in the bottom of the foot. So it's really important to inspect the bottom of the foot to make sure there's no atrophy or asymmetry between the medial and the lateral compartment of the foot and compared to the other side. It's really hard to test for intrinsic muscle function, except you can ask him to try to fan his toes apart and bring them together. So you're testing some of the abductors and the adductors of the toes. In terms of the sensory function of the tibial nerve, it's really through two major branches, the medial and lateral plantar branches. So the medial plantar branch will supply this area of the foot, and the lateral plantar this area of the foot. So you can test that with light touch, pinprick, and the various other sensory modalities. So that completes the examination for the tibial nerve.